CompassConnect is reshaping the healthcare experience for employers and the employees and family members covered by their health plans. It is Payer Compass's transparency solution that unveils actual costs for care and quality. It bridges the gap between care and patient, creating access and value. CompassConnect enables plan administrators and employers to optimize their plan design and addresses members on an individual basis, providing insights specific to their health plan and medical claims, ultimately allowing them to take control of how they spend their healthcare dollars. CompassConnect is the ideal next step for group health organizations wanting more visibility into healthcare costs and an expanded version of patient advocacy. Combined information from Payer Compass's own data and multiple third-party sources provides cost averages for procedures on a provider-by-provider basis in real time. CompassConnect helps employers and plan administrators by delivering a simple, straightforward user experience supported by sophisticated next-gen technology. Portal access is optional. It's available at the plan administrator level only or as a benefit to plan members. Once logged into the platform, the plan member can access the dashboard to see past claims and their health benefit summary. To find a provider, use the easy-to-navigate fields and search by provider or facility name, specialty type, city or zip code, and distance. CompassConnect gives you an added level of transparency. Each provider listing has a color-coded icon indicating the level of acceptance for reference-based pricing plans. With green icons representing the most friendly of RBP plans to red ones showing you not only do those providers not accept your type of plan, but they also have a history of balance billing patients for higher than expected out-of-pocket expenses for care. Search results of similar providers or facilities can be compared across all criteria, so you pick the one that's right for you. You can also map the location and even call directly to schedule your appointment. You can also share your findings with others beyond the platform. Next, you step outside the portal and seek care with your selected physician or healthcare facility. Following treatment, you can rate your experience in the portal, from the provider's bedside manner to the overall facility experience. For plan members, the experience concludes here. The plan's interaction with CompassConnect is more solution oversight. It works with Payer Compass's member advocacy team to focus on relationships with RBP-friendly providers and facilities, as well as direct contracting. All of the claim, provider, and facility data, as well as patient ratings, are available to the plan administrator through standard or custom reporting. With access to this valuable utilization and satisfaction data, changes in plan design and program offerings can be made to better meet the needs of employees and their beneficiaries. At the intersection of price, quality, and care, CompassConnect drives healthier outcomes for your plan member population and your benefits plan through data intelligence and member consumerism. In the end, it's about restoring rationality to healthcare, restoring health, and restoring happiness.
Good afternoon. I'd like to thank everyone for joining us. My name is Kelly Jackson, and I'm Vice President of Sales and Client Engagement at Payer Compass. Since transparency and surprise billing regulations started rolling out, one theme has become increasingly clear: be prepared. This theme applies not only to the compliance solutions that need to be understood and implemented, but also to the ongoing changes that we hear about nearly on a daily basis. Our very own Mary Pakuch, whom I'm about to introduce, is part of SIIA's Price Transparency Working Group. She eats, breathes, and sleeps these legislation changes with a group to help our industry understand the critical actions and deadlines. We're not here to rewrite the book on the interpretation of the No Surprises Act and Transparency and Coverage Rule. SIIA is the source of truth for that. What we are going to do today is show you how to transition from the written word to actual transparency solutions you can implement now. Payer Compass is releasing an enterprise technology solutions suite that integrates our provider transparency tool, CompassConnect, with price transparency, shoppable codes, machine-readable files, and advanced EOBs with qualified payment amounts. Payers, health plans, and self-funded employers. You don't need to shoulder the burden of staying on top of all these compliance changes. And it's time to give your plan members more access to provider and procedure costs, as well as reliable quality information so they are empowered to make intelligent healthcare decisions. We'll be sharing the following key objectives with you during our session today. First, new solution intelligence to help with your decision-making process to find a transparency partner. 2, introduce you to Payer Compass's single source turnkey stack, the features of each stack component, and their full integration for user and plan friendly portal access. Next, explain our expedited implementation process to get your groups fully functioning in time for the looming federal compliance deadlines. And finally, we'd like to hear from you and answer as many questions as time allows. Now, to introduce our speaker, Mary. Mary Pykuch is our Senior Vice President of Member Advocacy Operations and Product Strategy for Payer Compass. Mary is on a mission to help organizations to understand their unique challenges and to find technology solutions to improve their company's overall performance and products. She has over 30 years of unique experience in the healthcare industry and cost containment industry, working as a business analyst and moving into leadership positions in IT and operations for various health plans. With her sharp acumen and her genuine desire to help, she is a respected member of the Payer Compass team. As the Senior Vice President of Product Strategy, Mary oversees product responsibility for group health, which includes reference-based pricing, preferred provider organizations, networks, and out-of-network plans. She frequently collaborates with our sales and development teams to bridge the communication and prioritization between the teams for successful product creation and enhancements. Mary's a native of Chicago, Illinois, and currently resides in Warsaw, Indiana. When she's not in our office or with clients, she enjoys fishing, playing poker, and spending time with her family. With that, Mary, take it away.
Hi, Kelly. Thank you. I think
if I may, actually, Mary, I'm sorry. Before we get started, I would like to poll the audience. We have 2 polling questions. Here's the first one. So I think on your screen, you'll see a questionnaire here. Have you defined or selected your transparency solution or partner? Yes, no, or it's complicated and maybe you're not sure yet. So if you could answer, take a second, answer that. We just kind of like to see where people are as a baseline before we get started. All right, everybody can just log and answer real quick. We're going to see what the results are so far so that we kind of have an idea of where our audience is as we get started. And as I mentioned, I'll be watching the chat box. So as questions come in, if we can answer them as we go, we'll be happy to do that. And if there's not a natural fit there, then we'll certainly at the end address all the questions that we can. Okay, so majority says no, we have not decided or selected a transparency partner. So with that, Mary, now, please take it away.
Yeah, sure. Kelly, thanks for the intro. And thanks everybody that took the time to join us today. One of the things that we've been working really diligently here at Payer Compass is making sure that not just through regulations, but by our vision for really having price transparency or transparency in all things for our health plans and for their members that they serve. So without further ado, we're going to go ahead and get started. See if I can forward this. There we go. So it's interesting, and it's not surprising what the poll really showed that we just took, that folks are still trying to figure out what is their solution going to be, who's their partner going to be. I'm not surprised, and that's why we asked or put the option it's complicated, because ironically enough, all these regulations are super complicated because, as we all know, they're not quite all thought through. Specifically, our industry is complicated. So put those together and you've got a pretty recipe for a complicated task ahead of all of us. So what I wanted to do today is, Payer Compass has been having a lot of discussions with our partners. We participated in other webinars, participating in different industry forum groups, and wanted to make sure that we get everybody up to date. I'm sure everybody has heard a lot of the information that's been recently provided by some of the regulators. But I thought it would be a good opportunity to summarize some of the moving parts, kind of our own little John Madden uh, uh, timeline and putting X's and O's and seeing what we need to do in order to move forward. So earlier this year, hospital and provider transparency was launched. There's been some activity there. Folks are seeing that maybe a third or 2/3 of providers are trying to comply in one way or another, or appearing to be complying in one way or another, I should say. And that occurred earlier this year. Regulators started having some feedback around the May timeframe, and then July 19th, there was a recommendation by CMS that perhaps we need to increase the penalties for the providers in order to encourage them to continue to comply or do a better job at complying. So originally the penalties were regulated at $300 a day, which wasn't very much when you come to a large health system. And then the July 19th recommendation by CMS was really putting it to scale with the hospitals and making sure that there's a little bit more teeth in the regulation and the penalty. So it really is based on the number of beds in the hospitals, and could go up to $2 million. So really a dramatic change from, you know, a potential of $109,000 a year to almost a little over $2 million. So that's in play right now in 2021. The next milestone that was supposed to be in play was 1/1/2022, where we have health plan transparency kick off, which includes transparency as part of the Transparency and Coverage Act. Health plans were to be compliant again in a similar fashion to the hospitals with machine-readable files for in-network and out-of-network files, as well as pharmacy benefit manager files. This has been, and I'm also cautious, even within our own walls at Payer Compass, to say there's a delay. I'm going to continue to use the words of the regulators with deferred enforcement. Because how we're looking at it from a Payer Compass perspective, these regulators are on a mission to make sure that there's transparency in healthcare. This is something that's been in the vision of Payer Compass as well. So there's deferred enforcement on the health plan in-network and out-of-network machine-readable files to July 1st of 2022. And then there's more to come when it comes to the pharmacy benefit manager machine-readable files. The next major milestone that was in our playing field, so to speak, was Advanced EOBs, and that came out of the No Surprises Act. That was also something that was slated for 1/1/2022. However, with the Department of Labor, Health and Human Services, as well as the Treasury Department, all of those regulators came together at the end of last week and basically published that, you know, it's a little bit too early to regulate advanced EOBs. There's more complexities, complications that we need to think about with regard to engaging providers and allowing the health plans to really build the tools that make this successful with the intent of having transparency and tools for members. And then also out of the No Surprises Act is the qualified payment amount for providers and plan members for the whole No Surprises Act IDR process and out-of-network pricing. So what had happened is the first part of rulemaking for the No Surprises Act really focused on qualified payment amount with the interim final rule that came out on July 2nd. And right now there is a comment period that is starting to wrap up. A lot of the industry forums have completed their comments, or they're on the verge of hitting send in order to get those comments into the regulators with regard to that interim final rule, which really focused very strongly on the qualified payment amount as well as emergency services. And then the next major milestone, which complicated things, but I think folks have a little bit of sigh of relief, but again, you can't really rest on this one. As part of the No Surprises Act, there was supposed to be a price comparison tool that was due on 1/1/2022. That was also something that was deferred. And really, this one made a lot of sense. Sometimes that doesn't always happen, but this one really did. And it's the department's really trying to align the No Surprises Act with the Transparency and Coverage Act. The Transparency and Coverage Act had the 500 shoppable codes had to be on a tool for members to shop as of 1/1/2023, and then all other services by 1/1/2024. So instead of the No Surprises Act kind of jumping the gun and saying you had to have a price comparison tool by 1/1/22, they're taking those and they're aligning them nicely so that, you know, really get your price comparison tool, get your shoppable codes ready for 1/1/2023 and forward. The one thing that we really want to highlight, you'll see the asterisk next to, you know, the change in the date for the No Surprises Act price comparison tool. And this was something that internally at Payer Compass, you know, really made us steadfast that we need to keep our foot on the gas. We need to make sure that we're providing solutions. Is that albeit that they're deferring enforcement for the price comparison tool to align with the shoppable code regulation, the regulators are going to be watching. They want to hear that health plans are taking a step forward, not really dragging their feet when it comes to these shopping tools for members. And so don't take your foot off the gas. Don't think that you have more time to breathe. These are complex solutions that need to be created, and you need to find your health plan or solution because the regulators are going to be watching to make sure that we're all taking steps in the right direction and not waiting for the last minute and then again, you know, increase escalations and comments and stuff about the runway. They've given us another bit of runway in order to get these solutions in place. So these are the items that we're going to really be focusing on today during this particular webinar, really setting and resetting expectations with regards to solutions.
Thank you, Mary. Before we get started, and we do have a second polling question. Now that you've heard Mary explain all the various regulations, some recent changes in the regulation regarding time frame, the second question for you. Now that you've heard that, has your approach or your project plan to all things transparency, compliance changed at all due to the regulators changing some time frames? So I'm curious to see if some of the folks who said, yes, we've got a partner, we're marching forward, has anything changed in your plan now that some of the dates have shifted a little bit? Give everybody a minute to log an answer, and we'll look at the results, and then Mary will get back to her presentation, and no more polls for the rest of the session, I promise.
Yeah, we're trying to level set everybody to see like where folks are at, and then have folks had a chance to digest the information that came in within the last week with the deferred enforcement.
A lot of information to digest, certainly, Mary. So, all right. So again, looks like no, based on the recent changes and announcements of deferred penalties time frame, people have not changed their plan. So that's good news. So Mary, with that, please take us through the pieces.
Yeah, that's great news. So at Payer Compass, we're taking the same approach or thought processes that, you know, even though these regulations have changed or the dates or deliverables for the solutions, it really is important that we stay the course. Just to really kick off us here today, the solution that Payer Compass is using in order to deliver solutions and talk through these complex matters is CompassConnect. CompassConnect was something that I joined Payer Compass in March of 2020, and this was already a tool or vision that was already in progress when I joined the team. I had the benefit of continuing to take the baton on this one and continue moving it forward. So all things transparency was nothing new from a vision perspective for Payer Compass, which is comforting to me. It's not like we had to start at square one. We do have a tool that's already in the market. It went to market last July of 2020 with regard to transparency of provider information for health plans, especially self-funded, smaller health plans, or bringing together different solutions for providers that are available for access to care for members. continue forward. So I want to give a little bit of background on what CompassConnect is. So CompassConnect, the vision was to maximize transparency. And what does that mean? It means that our industry is very complex. There are so many different sources of data. Your average consumer has no idea of all the things that go into how to best navigate your care. A lot of us who are on the call today, we're super fluent, but even sometimes we have a hard time. So the goal of CompassConnect was to take all those complexities, whether it be provider data, claim data, quality data, cost data, all kinds of different sources, and really aggregate all that together and bring it together in a tool that was really meaningful and available to members in order to find good healthcare at decent prices or reasonable prices. So really giving a tool that allows a member to shop between providers for price and quality and moving forward. So our vision from a user experience perspective is having a tool that was available with a dashboard or an application that a member could use. They could search for providers, whether it be a specific provider that they've already been visiting, or maybe a friend or family member referred them to. Look up that provider to see if they're accepting their health plan or if they participate in their health plan. Look at what their quality scores are. And then, of course, the new piece that would be coming in is the price transparency. What is the cost for the care with that particular provider? They can go and receive that care and then rate the care. So what was the patient experience? So you have quality data from a source that's being aggregated in CompassConnect. And then, of course, incorporating what is the patient experience. So really you get that full vision of the provider from a member perspective so that they can make good decisions on their healthcare. And really this was the vision of CompassConnect going forward, well before the regulators put these initiatives in front of all of us. Okay. So CompassConnect. So we're facing transparency head on. What we're working towards here is making sure we're providing solutions for both members as well as health plans. Within CompassConnect, like I said, we already have provider transparency. That was our inaugural product when it came to transparency. We wanted to make sure that we created a tool that was easy for a member to use and navigate. The tool itself allows for searching by name, specialty, and geographic area. We have the ability to map it, share it, and also provide quality information today in the tool. And like I said, that was available in July of 2020. We do have a good amount of clients that are on it and providing feedback, which has been very helpful as we continue to move forward with providing solutions when it comes to the transparency initiatives. Our natural progression was to add on the price transparency. When I came in 2019 to Payer Compass, we already had a price transparency prototype that was created, which, our intent was to go right after provider transparency. And then what happened is we got all these regulations in Q1 of 2021. We paused for a moment so that we could really see, did everything that we had in motion meet the regulations when it came to price transparency. We wanted to make sure that our platform was ready for the machine-readable files, and then we can build up from there and create our shoppable codes, our price transparency, and then furthermore, make sure that from a staff perspective, we know who the provider is, we know what the price is. Now we can create the Advanced EOB in collaboration with our partners to bring in any kind of plan information or accumulator information so that you have that member solution when it came to transparency. Again, things that Payer Compass already had as a vision and an objective going forward from a technology perspective. The other piece on the right-hand side is solving health plan challenges. Not that everybody really wants to do this, but the regulators say we have to. We're seeing evidence that they're serious about the transparency of putting the price information out there. with regard to the hospitals going first and then the increased recommendation on their penalties. So from a machine-readable file, Compass's core platform, Visium, already manages contracts, very complex contracts, as well as claim and clinical edits for claims. Therefore, it's a natural progression again that we're a partner that we can create from those contracts and the claim data that we receive from pricing in order to create in-network machine-readable files as well as out-of-network files. So we are working diligently. We just released CompassConnect 2.0 into our development QA environment. So our platform, our foundation is in place. We'll be working with partners from an early adopter perspective in order to look at how our new platform is being prepared in order to put price transparency in the Advanced EOB as well as the machine-readable file, meaning be able to manage the data sets and the hosting of that information.
Mary, before you go on, we've got a couple questions that have come in from the audience, and I thought this might be a good time to address them before we get down another path. First question is, what is our source of clinical quality data that CompassConnect displays?
Sure. Our quality data today, our default is using CMS quality scores. We have been aggregating and bringing that in. One of our core competencies at Compass is working with Medicare data, whether it be the prospective payment systems, but also bringing in and ingesting and aggregating the quality data. We have been in discussion with many of our partners that are using CompassConnect, and we're open to plugging in other quality data. So we know that other partners use other services like Montrose or other quality services, and we can absolutely plug those in. But our default out of the box is the CMS quality scores.
Thanks, Mary. And the next question that you may come into play as you're going through the next couple of slides on workflows, but the question is, will CompassConnect be able to provide a solution for PPO and not just reference-based pricing?
Yep, for sure. So, and I encourage folks to reach out to Kelly and other members in our sales team because we have been very busy doing demonstrations on CompassConnect. So with the provider transparency, one of the things that we knew we had to have put in place was the ability to customize CompassConnect. So initial thought process was, hey, we need to get a tool out there for our BP plan so that they know the providers that are accepting their plan. However, in forward thinking and retrospective thinking on traditional PPO plans, we can take in provider data just like we can for any of our BP plans and ingest the provider information to our database. And we can configure the status codes and put, again, meaningful legends or colors. So if you're familiar with CompassConnect or you got to sit in on a previous demonstration, there's a legend that's very synonymous with a streetlight. So members who don't speak fluently into healthcare, they know, most of them, about a streetlight. Green means go, yellow means proceed with caution, red means you want to steer away from it. However, there are additional color coding for maybe a narrow network or a PPO network that could sit within the tool as well. And we also have it where our partners can change the wording on the actual legend itself. So perhaps when you get a proceed with caution, it means really call your health plan or call your patient advocate in order to proceed. You can stack the network so that you have your priority network before a secondary network so that the members really are, you're using it as a steerage tool as well as giving a tool in their hands.
Well, thanks, Mary. That's all the early questions we have. So please take us to the next section.
Okay. So the next thing I want to talk about, so we talk a lot about CompassConnect and the interactive tool. We're going to come back to that in a second. So the next piece here is the machine-readable files. So I want to go a little bit further on the machine-readable files. So again, from a perspective of where Compass is, we have a really good foundation today because we have Visium. For folks that are familiar with it, it's our contract database that we're using. We manage contracts today. We bring in regulatory data, whether it be Medicare or Medicaid, TRICARE, a lot of repricing platforms in order to adjudicate claims and price claims. So we already have that today. So what we're working on today is the aggregation of the information. Aggregating the data from an in-network perspective means per provider, per contract, per service, we have to be able to create a file that would be available via CompassConnect. And that's our platform for creating the actual deliverables for the transparency solutions. And really providing that to any of our partners, whether it be on a hosted browser site, which we can do via API services, or it could be via FTP, meaning we can place the files for our partners to pick up the files so that they can put it on their own home pages or web pages. So if they were to be audited by the regulators, they would be accessible. One thing that in our actual deck here, we want to make sure that we're following and in compliance with our solutions, that we are closely monitoring the CMS government website, the GitHub website, which if folks are not in there already today, you should be. I'll warn you, once you sign up, you get a lot of emails because there is a live discussion board. It's interesting. You don't have to read everything, every line, and ingest everything, but I find it to be a super useful tool, not just from our technical team's perspective, but me as a user, that I can see every day what is the topics that are really being active, what are the collaborators, meaning us in the industry from a technology solution, providing feedback to CMS on their regulations as far as the content for those XML and JSON files. It keeps you up to date on what's going on with those machine readable files. And I'm not going to lie to you, there's a lot of emails because it is a live discussion board, but it keeps you updated. So you're not starting from square one when it comes to what's going on with the machine readable files. Okay. The next workflow is the out of network data flow. And again, when it comes to out of network, it's really claim data. So here at Compass, again, our platform is designed in a way that we have real-time pricing or batch pricing with our partners. So we are receiving claims, millions of claims every year to price, whether they're in-network or participating providers or their default or out-of-network solutions. So we do receive the claim data. And remember, when the regulators are looking at out-of-network data, they're trying to understand when it is out-of-network, what are the billed amounts and what are the allowed amounts that are being provided on out-of-network solutions. And again, we're taking this information based on what's already in our platform because we're pricing claims today. We can also take external files, whether it's an 835 or a flat file that we agree on. And this is really coming into play where perhaps Payer Compass doesn't have all of the claims because maybe there was a settlement made after we priced the initial claim. Perhaps the health plan made an adjustment because there was an appeal. And so we want to always make sure that when we're providing that out-of-network solution in the files, that we're getting the most current claim information that can be aggregated together and be considered when we're producing the out-of-network data file. And again, there's a browser, and I'm going to talk about that next, or you can get it via one of these other methods for delivery or FTP. Okay. So what did I mean by the browser? So one of the things that the regulators are really talking about is you have to make these files readily accessible. They cannot be put behind a registration where you have to have a user register to gain access to them. They have to be out in plain sight, and I believe the words were prominent with our interpretation, more than likely in a pricing section or something to do with reimbursement information. Can't be buried, which is what we're seeing today sometimes in the hospitals files that are out there. It has to be accessible, not registration requirements to access the files, and you can't have them password protected. They have to be readily accessible to the regulators and others. So what that means is you either have to have your current portals updated so that you have a place for these files to land, or Payer Compass will offer the fact that we can create your hosted site, meaning we would use logos that are specific to your health plan, colors that are specific to your health plan, and then of course make sure that there's a way in order to get those files available so that you're in compliance when it comes to the machine-readable files. Furthermore, we would be implementing logic that we would produce the files every 30 days based on contracts and claim data that was received in the prior month so that you are in compliance for the ongoing regulation. Okay, I also talked about, so we talked a little bit about machine-readable files. Now we're really talking about the price transparency and some of the tools. So Payer Compass has been really focused on member-centric solutions. So it's not just about price transparency when it comes to how we want to provide solutions and technology to our partners and to their members. It's really making sure that we're trying to help the member in a holistic fashion. So at Payer Compass, we have not just pricing services that we're providing. We also provide patient advocacy. So part of my role is overseeing all of member advocacy. And when we talk about that, it's really patient advocacy as well as resolution to balance billing advocacy. So our portal has been upgraded so that we can have members access their cases or start cases via the portal. So while they're shopping for care or looking for a provider for services, while they're looking, they can look for the quality information, they can look for the price information. And if for some reason they don't see that green or the indicator on the legend next to their provider, they can open a case for patient advocacy so that we can start to help facilitate acceptance of that provider for their health plan based on the services that somebody would be signed up for. And then furthermore, once they go in for that care, Payer Compass also has in our advocacy area balance bill support. So if there is a balance bill issue, our portal is created in a way that we offer self-service for a member to get support when they do get balance billed, making sure that Payer Compass's expertise from resolution advocacy is at play, as well as some of our partners that might provide legal support. So going further into the price transparency, we're taking an approach that it's not just for each procedure. So remember, when we're talking about price transparency, the regulations say that you have to have shoppable codes. You have to have a price per procedure code. And then you can also have a course of care. So we're taking two approaches when it comes to price transparency. If you know the procedure that you're going to have from a member perspective, you can look it up by doing a smart search on that procedure code or the actual CPT code in order to get the price in that demographic area, but also based on the contracts that we have loaded and available, what the actual price would be for that given provider or that, potentially the out-of-network solution. And then furthermore, incorporating any member accumulator information with our partners when we get the plan information in preparation for the advanced EOB. Also from a course of care, so say for example, you have a knee replacement in the Dallas, Texas area. We would be presenting providers that would be synonymous with that type of procedure in order for the members to start to begin to understand what it means for price transparency and availability of providers from a facility, a professional or a specialist, as well as any kind of the ologist, so radiologists, anesthesiologists, pathologists, making sure that we're providing all that aggregated information that I talked about earlier in the slides within the tools so the member can navigate their healthcare and, to some extent be their own advocate, but also have additional advocacy services at their fingertips.
Mary, a couple questions have popped up. They kind of vary in topic. So actually the first one I'll take and then I'll get two more for you. But first question is, does Payer Compass audit and reprice claims or do we use another vendor? So certainly one of our core competencies at Payer Compass, Mary mentioned it, is our Visium application. That is where we take in claims, we group, edit, and price them to whatever the direct contract or plan document says it should pay. So in the case of reference-based pricing, typically a multiple of Medicare. So we do all that in-house. We price claims for reference-based pricing plans, narrow networks that their contracts may or may not be, based in Medicare. We price claims for health plan claims, Medicare Advantage, Managed Medicaid, all things claim grouping, editing, and pricing. So that one I could handle. Mary, the next one to you. This goes into a little bit more about our operations than necessarily, I think, CompassConnect, but I'll let you fill this one. Question is, how do we know which providers will accept reference-based pricing? And since they vary, how do we track variations in price in providers' tolerance levels? So can you maybe speak to that from a technology perspective, not necessarily an operational one?
Sure. So going back to provider information, we do aggregate provider information, not just from our claim information, but also from as a result of our advocacy services, but also the service of managing contracts on behalf of our partners. So based on how a provider would be willing to participate in an RVP plan, we actually have status codes, criteria for each provider. We can do it at an overall health plan level, or we can do it at a group level. So say, for example, a ABC roofing company in Dallas, Texas, for whatever reason, they were able to gain access to a provider in their RVP plan. But the provider said, we're only going to do it for you, ABC roofing. We have the ability to administer contracts and provider data at the overall health plan level, but also get down to the group level. So when a member is signing into CompassConnect, they're going to be signing in based on their credentials. So Mary Pikush, working for ABC Roofing under the health plan, when they sign in, we know what we can present to them as accepting providers. So the health plan may have already had a universe of direct contracted providers, and then that group brought in that additional provider. Those would all be displayed as green providers, meaning they're safe harbor providers, and members can be rest assured that they can go to those providers without recourse of balance billing. We also make sure that we're taking all the intel based on the fact that we know there's a lot of RVP friendly providers across the country, because we service health plans across the country. And we also are at pricing claims for a lot of RVP. That's a big bulk of our business, is in our Innovate 360 product. So based on intel, claim information aggregated, contract information aggregated, that's where we have a color-coded system for providers, and they might be in the yellow, meaning they're potentially going to accept RVP. And you can go ahead and, we always tell, especially from an advocacy perspective at Payer Compass, it's an open access plan. You can go anywhere you want. However, the yellows, they're not actively accepting. We don't have an agreement in writing on behalf of your plan or group, but we know that they have accepted RVP plans in the past based on evidence in our data. And you can go ahead, call that provider. And when you call that provider, if they have questions, that's where you call your advocacy services, and we'll get on the phone with the provider and we'll educate them about the health plan. We'll also facilitate negotiations on your behalf so that we can get them to turn from yellow to green. So it's good intel being part of the CompassConnect platform, not just from a member perspective. Our partners, though, we share that business intelligence. So for prospecting, those yellows could be a potential accepting provider if you go to reach out to them and try to build a relationship. Or it's a universe available for the health plans to also go see. Perhaps those yellows are ones that we want to target for direct contracting based on where they're located and how much membership we might have in that area. And then the third category is red. So we offer balance bill services at Payer Compass. If we know that a provider is an active balance biller, we will indicate for that provider that they have a status, and we call it red. There's a code behind our scenes that we're aggregating this data. We will make it red. Doesn't mean a member can't go to them, but we want to make sure that they're making a decision based on information provided that they could be balance billing. We also utilize that status for our health partners, for providers that they want to be cautious with the members going to. Perhaps there's very large, prestigious systems where, you know, we want to use them when it's necessary, perhaps for very specialized providers or courses of care that we would want members to call in before they actually access those providers. So that's really how we're bringing all this data together in our operations.
Thanks, Mary. Several more questions that have come in. I think it's a good time to address them as we go through the deck. One is about, sorry, here, I lost my, our connection with our TPA partners. So is the pricing or the contracted rate or the out-of-pocket amount specific to the members, to the member, depending on the member's deductible, co-insurance, co-pays, etc.? So how are we handling all the accumulators, or are we?
So right now, we had 3 approaches going into the No Surprises Act come January 1st, because everybody was marching towards making sure you had advanced EOB information, which when you read the regulations, that has to include accumulators, meaning their cost share, co-pays, and deductible information so that you can produce your good faith estimate. We are going to continue moving pretty swiftly forward, but we are making sure that we're using the best technology available, making sure that the weight of this doesn't fall on our TPA partners. So we're very involved in industry forums, especially technology forums, that are collaborating on a consistent file format for exchanging this data. So we're engaging in some of these projects. Just came off of HIMSS out in Las Vegas, where there were groups that were meeting on it several times a day about the potential file formats of technology that would be used. So that's the ultimate solution. And what that would be doing is really, regardless of your claims adjudication platform, you would have a standardized data set to exchange this data, kind of almost like your ANSI standards. However, you know, we do have a short runway, so we're keeping an eye on can the industry get to that place where we're on this standardized format so we can exchange this data. You know, there's, you know, not a finite, but a decent amount of standard claim adjudication platforms that if we're all using the same file format, that's the golden rule, is we want to be able to use the same file format. However, we're not resting on that, because we know that those are very complex decisions and collaboration across the industry. So the next, or I should say the next parallel swim lane is really an API with our claim adjudication platforms with our partners. Today, Compass does have a real-time API that we engage in with many of our partners, where we're pricing claims sub-second. Our API here, if that industry standard format doesn't go through or pan out for everybody, we would be following a similar API toolkit that we already use for pricing today in order to gain information and exchange information for accumulator data so that we can produce the advanced EOB with that additional information.
Thanks, Mary. A couple of other questions. Some of these I think I can help with. Questions: how long has Compass been in the business, and are we national? How big are we? So Compass has been a company since 2013, and we are national. We have groups coast to coast. Our groups number in the thousands size. Some groups are small. Some groups are thousands of employees. So it is a large membership across the country, partner with multiple TPAs in order to service all these groups. Next question is about, you mentioned our safe harbor data, Mary. Question from the audience is, when a member signs in, are they looking at just their particular group's plans safe harbor? So the answer is yes and no. So certainly again, Mary talked about all of the algorithms behind and how we weight information to the user. So if I'm with a particular plan, I certainly will see my known safe harbor providers first, but we do source in our entire book of business all our RBP experience, whether it's on claims, outreach from advocacy, balance billing. We have all that data in there to allow members to help navigate, so they can navigate. A great case in point, you may have a remote member living in another part of the country for your group, and whereas all your membership's in another state. Well, we may have other groups in there in that same area. Therefore, their member could take advantage of seeing all that data that we have for multiple groups across the country. And I think with that, Mary, I think we got a couple more slides and hopefully some more questions coming in.
Yep, sure. So next slide, how does this all come together? So this is one of my favorite slides because when we talk about all these different pieces in healthcare, it's like it makes people's head hurt. In every industry or every company I've been with, there's these platforms that have to come together and provide these solutions, and they're complex solutions. So I like to kind of lay this out for people to say, okay, how does this all come together? So you have your service codes. You have providers that are going to provide services, whether they actually provide us the actual codes or have communication with the members about the services they're going to have. They're going to interact, whether it's the TPA partner or the TPA partner is going to bring them to the CompassConnect portal so that we can provide solutions. And that safe harbor list, again, is something that can be in the hands of the member so that they have information. And again, working in partnership with our TPA partner, we're able to aggregate and house the information based on claim information. We're bringing it through Visium. So between what's happening in the portal that I was talking about from a CompassConnect perspective, whether it be finding a provider, accessing member advocacy, or shopping for pricing for codes, and getting all the information and the intelligence that we have within our Visium platform for pricing and contract information, as well as provider information. We're taking all that and we're bringing it into the transparency and coverage. So we're creating our in-network files, making sure that we're taking into consideration contracts, PPO contracts, aggregating that information, making sure that we're understanding by provider, by contract, what their pricing or reimbursement would be, and then taking the claim information so that we can create the machine-readable files, really boxing that up as our main data set, then laying on top of that our solution for shoppable codes so that a member can actually shop for codes, shop for services, and then the ultimate is really being able to create that advanced EOB. So really this is, you know, a good slide for how does this really all fit in for everybody. And of course, my dog is barking at the most inopportune time. Somebody must be coming.
I was gonna say, you must have the Amazon delivery man must be there, so.
Or perhaps somebody just happens to be walking on his street. I always say that. So anyway, so we're gonna wrap things up because I know we're coming to top of hour. Everybody's time is very important. Just putting out there a couple helpful resources. I talked about the GitHub site from CMS. It's very important. I encourage folks to register or subscribe to their discussion board. It keeps me up to date on what the hot topics are. And then of course, that's your technology guide for the machine-readable files. So our developers are keeping an eye on it and they're using it in their functional specifications as well. And then of course, CMS Newsroom. You know, we've had two in the last, 60 days, 45 days, pretty important releases of information, whether it be the interim final rule, CMS, you know, wanting to increase the hospital or provider penalties, and then of course this delayed enforcement that just came out last Friday. So just some helpful resources in addition to everything else you can find out there. These are pretty important. And Kelly, I'm going to hand it back to you for a wrap up for us. And thanks to everybody for joining. I really appreciate it. It's not always a fun subject, but hopefully we've gotten it to a place where it's easy to digest, and look forward to talking with folks in the future.
Thanks, Mary. Thanks everybody for joining in today. Hopefully we provided a little insight to some of your questions, gave you some good information on what our solution stack will be for transparency. As it says on the slide, we'll be at SIIA's National Conference in October. looking forward to getting back out there and reconnecting with everyone after a year and a half of all the remote stuff. You'll also be hearing from us after the webinar is over. We have a list of who attended today, so it'll have our contact information. I welcome you to reach back out if you'd like to follow up and do a little deeper dive. I think I covered all the questions in the chat. If not, again, we'll be following up and providing contact information, and we'll make sure we cover any questions that we didn't have time for today. So I think we're ending just on time. Appreciate the time you spent with us this afternoon. Goodbye.
All right, thanks everybody. Bye.